Qualcast Nation, we have a very special guest today. We got Dr. Mike Hart, cannabis specialist, physician, freaking beast of a man too. Works. I haven't met you in the flesh, but you look like you're jacked as all hell. But Mike, welcome to the show.
Thank you so much for having me here, brother. I'll try to live up to that introduction, but we'll see what happens, okay?
And it's been like we've got to know each other for a bit now, and it's funny that we've never met in the flesh. But I feel like we're cut from the same cloth, if you know what I mean.
100%, man, 100%. And we'll definitely make it happen in the flesh at some point, you know?
It's
You're
gotta
just all the
happen.
way in Ottawa. I'm in London, so we're probably about 8 hours away or something like that.
Yeah,
But we'll have to make it happen someday. I'm sure we'll meet up in TO or something like that.
exactly. So we're going to talk about something that has we've never covered in the 5 years of having this podcast is the landscape of cannabis. And I maybe even before we start, Mike, like how did you get into that space?
Yeah, sure. I can answer that question. So, initially, the reason why I got into it was because there was a lot of people coming to me that couldn't sleep well. That was kind of the big thing. And they were using drugs like, Zopiclone, Trazodone, Seroquel, like there's lots of different ones out there. And I'm not saying that, those medications aren't effective for some people. For some people, they're incredibly effective. They're lifesavers. But other people want other options, and some people, they just have an aversion, I guess, to pharmaceuticals. So I'm not one of those people. Like, I think that you should just make your decision based upon, risks and benefits. And sometimes there are some pharmaceuticals to take when, the risks do outweigh the benefits. But, some people really just want to try something natural and they want to have something that's, non-pharmaceutical based. And that was kind of the big reasons. A lot of people were not sleeping well and sometimes not getting the results that they wanted with the prescription drugs that I just mentioned. I mean, obviously there's other ones as well, but those are kind of probably the big three that I just mentioned. And so because of that, I wanted to be able to offer something else. And I knew that using cannabis can be effective for sleep. I had not used cannabis like medicinally at that point in my life. Like I had used it. Like I was certainly not like by any means of the stretch of imagination, like a pothead by any, like when I was in high school or university. Like it was just like, if my friends had it on the weekend, like I might kind of use it with them sort of thing, but I wouldn't have it like on me all the time or anything like that. But, I had used it and other people I know had used it, for sleep, like successfully. So it was something I wanted to offer to patients. And so I started practicing 2013. And then in 2014, right at the beginning of 2014, was when they introduced this MMPR program where it kind of became easier for physicians to prescribe cannabis. Because at that point, the only way in Canada you could prescribe cannabis is to basically have someone grow it for you, or you could grow it yourself. And so it was a little bit cumbersome and kind of difficult in how to manage. And you couldn't order things like CBD oil and that kind of thing now. And so from there, I delved into that program and just had a lot of success with people who really struggle a lot with sleep. But it is used for so many different conditions right now. And when people think of cannabis, they think of THC. And I understand that because, that's what, people use in high school and university to, get high. But there's so many other cannabinoids that are incredibly effective, and we can certainly chat about those today. But, basically, the roundabout answer was I just knew that there was, some treatment, like cannabis was a good treatment for some of these conditions that people have, particularly with insomnia, but certainly for chronic pain and sometimes for anxiety as well. But like I said, I'm totally willing though to talk about the negatives of THC today as well, and I think that we should discuss that at some point to have like a full discussion about it.
Absolutely. And it's because I think I'm just going in a bit naive. Like I hear a lot about many of these benefits: sleep, some chronic pain. We see it a bit in my wearing my palliative care hat, but the effectiveness, the other indications, I think are a bit of a mystery, and I think a lot of people also worry about if there's like some chronic side effects or long term impacts of use. So maybe at a high level, Mike, like we could just cover where you think people would get benefit. And then also, not to load the question too much, but if and are these impacts mostly from a cannabinoid perspective, or is it some of those impacts related to THC? This is to me a bit of a mystery too.
Yeah, so why don't we maybe chat about, a couple different cannabinoids? I think that may just make the discussion a little bit easier. So THC we know is one that gets people high, and it does have some, therapeutic benefits, but it also has a lot of drawbacks as well. And so the therapeutic benefits that people get is, like I said, for some people it can really help them with sleep. For some people it can really help them with pain control as well. And so those are sort of like the bigger ones. And a lot of people too do find it helpful for anxiety, but you do have to be careful with that, because if you do use high THC cannabis all the time, which I don't advise to do, eventually you will develop a dependency on it, and you're going to need more and more THC to get the same effect. So, I really think that THC should be used really methodically. So you should be measuring, and you should be knowing exactly how much you use, how much cannabis you're using. Like, I don't like the answer when someone says, I'll use like 2 or 3 joints a day. Like, I don't know what that really means, because I don't know how much, cannabis is in each joint. I don't know what the percentage of THC is in each joint. I don't know if they're putting CBD in that with it. So there's a lot of different, things that can, impact the way someone can use cannabis, right? And so you want to know exactly how you are using it. And so THC, like I said, is the one that can get people high, but let's talk a little bit about CBD as well. So CBD is a non-intoxicating cannabinoid, so it's not going to get you high. A lot of people also find this to be incredibly effective for sleep. They also find it to be helpful for anxiety, and they also find it to be helpful for muscle spasms and for pain. I find with multiple sclerosis patients, actually, that's almost like their number one drug for muscle spasms is CBD. It's very, very effective for that. And then coming back to the other indications. So, sleep, I mentioned now several times. So some people can get away with just using CBD only for sleep. And some people will need a little bit of THC with the CBD to help them sleep at night. And what I'll say about using the combination is that you're less likely to develop a tolerance to THC if you're using more of a higher CBD content. So say if you use, 10 milligrams of THC on your own, and then eventually you may need to use 15, 20, 30, it may just keep going up. But I find that with a lot of my patients, they use, say, like 10 milligrams of CBD and then say only 5 milligrams of CBD, maybe in that combination. And sometimes you do need to move, a little bit up. But if you use a combination where it's more favored in the CBD than the THC, then you're less likely to get to develop dependence or tolerance to it. And then the other aspect of that there is that, you're getting the benefits of both of those cannabinoids. And so, and just going back to, THC for a second and how, that works. So for sleep in particular, like for people who have nightmares, like veterans, THC has been shown to be helpful. And there actually is a medication that you can get at Shoppers Drug Mart or at any pharmacy in Canada called Nabilone. And Nabilone is basically just THC in a pill form. Now, it doesn't have all the other cannabinoids and terpenes in it. So a lot of the, cannabis purists, don't really think that it's, a good medicine in some ways. But regardless of what other people think, if you do look at some trials of using Nabilone with patients with PTSD, it does help reduce nightmares. Now, the issue there is, like, some people will say that it can reduce REM sleep. And so I've asked, Dr. Ethan Russo, who's sort of like the godfather of cannabis, I asked him about this on my podcast, and he said, like, the reduction in REM sleep is so incremental that, like, it's not really much to worry about. That being said, if you are worried about it, you can use one of these trackers like Aura or Whoop or anything like that to see if it's, making a difference. And again, that just comes back to being more aware and being, careful about how you're using it and being methodical with it. So, if you can have something, to track it, then that would be beneficial and then you'll really know for sure. And then the other thing with THC with regards to pain control is, so, I talked about how CBD can be effective for muscle spasms, and CBD is more of like an anti-inflammatory. So it's helpful for like repetitive injuries and that kind of thing. It's not as helpful, unfortunately, for neuropathic pain sometimes. So like diabetic neuropathy, numbness and tingling, sciatica, these kinds of things. So the way THC works is that it kind of blocks a signal that goes, say, from your knee to your brain that tells you that you're in pain. So a lot of my patients will say that, they can kind of still feel the pain a little bit, but it just doesn't bother them. And they will report that, overall can have a pretty drastic reduction. Like some people, it may only be, 10 to 20%, but for some people, it could be like 80% to 100%. So, a lot of different ways that it can help. And then, coming back to the anxiety component. So, I'm well aware of the fact that, if someone who is a naive THC user, consumes THC, then it will increase your heart rate, and it may make you feel paranoid, and it may make you, feel uncomfortable, like you're having an unpleasant experience. So you do have to be comfortable with that. So, that's why I always suggest to people that, to try CBD initially, because it's a non-intoxicating cannabinoid. And then if you want to add in, THC later, do it very, very incrementally. And you can get, 2.5 milligram pills. And that would be, a very good starting dose for a lot of people to introduce. And just one thing that I wanted to mention there too. So I advise against smoking cannabis. Like, don't smoke cannabis. You should try to, use it through an oral form. It's definitely best. Second best, would be vaping. But, again, vaping is just less harmful than smoking. It doesn't mean that it has, no risks at all. And there could still be some, acute lung injury risk with it. So you do have to be a little bit careful with that. So I would advise using, more of the oral form, and then also making sure that you're, being methodical about your doses and that you know exactly how much you use. So, if you're going to use cannabis medicinally, treat it like another medicine. Like treat it like the medicines that you have in your medicine cabinet, where you know exactly how much is in each dose, and you know exactly how much to take each day. That's the way that it should be done properly. That's the way to use it medicinally.
Well, that's a beautiful summary. I so like I'm 4 years old, Mike. The reason to add THC then for folks. So say whether you're going to highlight sleep pain or anxiety. Well, it sounds like there's a different, like in terms of the pain, there's a different area that it's impacting, like more improvement from a neuropathic perspective, as you mentioned. But in terms of the other stuff, whether it's sleep or anxiety, is there a reason to tell yourself, yes, I'll need to add some THC?
I wouldn't add THC unless you need to. Like if you can get away with just using CBD, then just use CBD. Don't add in something that, could potentially, get you, addicted to something. You only want to add it in if you feel like the risks are going to outweigh the benefits. And, when you're like a veteran who's, been overseas and you've come over, back to Canada, and you can't sleep and you're just kind of going crazy, then obviously, using a little bit of THC to help calm you down, to help you sleep throughout the night, is going to be beneficial for you. And then in that instance, the benefits will outweigh the risks. But even in that instance, you want to be methodical with it. You don't just want to like smoke high THC weed and, kind of like hope for the best, and I'm not saying that like you have to go to, a doctor or anything like that. But, when you do go to a doctor, hopefully they'll be a little bit more methodical and tell you how to use it properly and how to use it medicinally in certain specific dosages. And so, like I said, if you can stay away from THC, then, stay away from it. But if you are going to add it in, do it very incrementally. And like I said, there's plenty of, 2.5 milligram tablets out there. And that dose seems to be, incredibly helpful for a lot of people, and it doesn't cause generally any intoxicating effects. So even if you haven't used THC before and you take 2.5 milligrams, I'm not saying you'll have zero psychoactive effect, but it'll be fairly minimal overall.
You've mentioned a couple of the side effects or things of concern. Do you want to go through some of the other areas that make you anxious or people should be aware of in terms of if they're going to explore taking a cannabinoid?
Yeah, I mean, again, like I'm really only concerned about, THC in terms of like an addictive type of property. Like the other cannabinoids, like I did mention CBD, but some people, may have been are asking themselves why, I haven't mentioned things like CBN or CBG, and I can talk about those, a little bit as well because I think that's will help with the discussion. So, CBD, as I mentioned, is sort of like the one that a lot of people are very, very aware of now. And and as I mentioned earlier, it helps a lot with anxiety, it can help with sleep, help with pain control, help with muscle spasms. And you can even help kids, who have seizures. Lots of people, listening to this has probably seen the Sanjay Gupta documentaries on CNN that he put out starting maybe like 10 years ago. I think they were literally just called like Weed 1, Weed 2, Weed 3. He put out a few of them, but it can be helpful for those types of kids who have irretractable seizures. Maybe even more so than that, I think one underrated place or one underutilized place is probably in children who have behavioral disorders. So kids with like autism, and kids even with just like with anxiety and with depression and with ADHD. A lot of, in my opinion, trying CBD first before like an SSRI for someone like that is, in my opinion, safer and likely will probably induce better results in many ways as well. And so I think that like for kids who are, and because I'll admit, like I don't really prescribe SSRIs and that kind of thing to like teens and adolescents and kids, and it's outside of kind of like my scope of practice anyway. If someone wanted to do that, I would refer them to a pediatrician or maybe a psychiatrist. But I think that there is an opportunity or a way for people to utilize CBD for a lot of these kids, instead of putting them on stimulants or instead of putting them on an SSRI. I think that using CBD may be more effective. And talking about the developing brain, and I completely agree that you shouldn't be using high THC cannabis, especially before the age of like 21, but probably even 25 before your brain is fully developed. But what effects are these SSRIs and all these vitamins having on kids as well, during that age group? So I'd like to see some data on that as well, and that has to be impacting the brain at some level. CBD seems to be a little bit less benign, so I think that introducing that into, or having that as more of like a mainstream kind of medicine, or accept it for that age group, would be helpful. And then, but I didn't mention the other cannabinoids I was going to get into. So CBG is kind of bigger also. That's another cannabinoid. And that's very interesting. There was actually a study done recently, maybe just 2 to 3 months ago. One of the authors on it was Dr. Ziva Cooper, who I know a little bit. And she administered 20 milligrams of CBG, and this is to healthy volunteers. And they had better verbal memory at the end of the study, and decreased in anxiety, and just overall better performance. So, I think that, there's other cannabinoids that are, on the way that can also be extremely helpful for people. And even now, you can get CBG. It is commercially available, like through various different licensed producers on the Canadian websites. Even through like OCS, you can get CBG oil. It's often actually used in combination with CBD. And so some people, will then ask, okay, well, what's, better, CBD or CBG? And so they have some overlapping but distinct mechanisms of action that are actually a little bit different. So CBD mostly acts, we think, on the 5-HT1A receptor, but CBG also has some adrenergic component to it as well. So because of that, it seems to help a little bit further, even with anxiety in a different mechanism, in a different way. And so, that's extremely exciting and extremely helpful for a lot of people. And like I said, not even for people who have anxiety. You could almost look at it as like a nootropic or something to take like before even something like this, like a podcast, to just like, improve your verbal memory or your verbal fluency, right? I should have taken it before this one.
No, you're
But
killing it. You're killing it.
yeah, and then the other one I mentioned too. So CBN. So a lot of people are using this one for sleep. Dr. Ethan Russo indicated to me that he thought it was a little bit overhyped, and we don't have too much data on it right now in terms of like randomized control trials. And so most of the evidence on that is a lot of like anecdotal stuff, but most people use CBN for sleep. And so, these are just like 4 cannabinoids that we're kind of talking about. They say there could be like 80 to 100 in cannabis, which is like crazy. So like there's going to be more and more coming out. The one that's like super exciting, or like I don't know why it hasn't been developed more commercially, because I think it would be very successful. So it's called THCV. And so
You said
THC,
T.
yeah, THCV. So just THC with a V at the end of it. And so that was shown in a study, like a randomized control trial in 2016, to reduce hunger. And so, we know how popular Ozempic is. And so, it's just kind of strange that this has become commercially available or hasn't been really like isolated where you could get like, THCV oil. But from my understanding, like I've chatted with a couple like growers and stuff like that. And, I'm just a doctor. I'm not like a grower. I don't know like, how to grow cannabis and, even if it's possible. But people kind of have mentioned to me that with THCV, it's just like harder to extract for some reason. So I don't know. But I mean, someone's eventually going to figure it out. I mean, they got to.
No, that's a nice summary because to me, once again, a lot of this has been just like a mystery. So a couple questions just going back a little bit. So with the kids, is there data to support that? I'm just because this is like a first for me, like in terms of utilizing it for some of the mood disorders and so forth.
Yeah, so there's definitely data on, I mean, we have Epidiolex, say, for like seizure control and that kind of thing. And then there is, some data as well. There's only like a few trials that indicate that, when you give it to kids who have autism, they have improved behavioral control. And then is some studies indicating that, when you give it to adolescents, it can be safe and effective as well for things like anxiety. So there is, some evidence on it. I do think that, we do need like more robust evidence for sure. But overall, like we have, some scientific evidence, we have, quite a bit of anecdotal evidence. And then the other third thing or component of this is, when you compare CBD to some of the other things that you would give, it just seems to be a lot more safe, And so I
So
think
really, like
there's
from a safety perspective, Mike, like with the youth, there didn't seem to be any like, as far as you know, like any long term implications of like
no,
just CBD.
no, not at all. Like, I mean, now, like again, like if you look at something like SSRIs, like a lot of doctors will probably tell you, the same thing, that like, giving it to kids, there's no long-term side effects and that kind of thing. I don't necessarily know if I agree with that statement. So some people, may push back and say the same thing to me about CBD. But in terms of like the studies that, I've seen, at least in the short term, it seems to be, very, very well tolerated, very safe. And then the other part too that I should mention too, they have done studies where they've, given people like a decent dose of CBD, like I think in the ranges of like 150 milligrams a day, for a few weeks, and then just abruptly stopped it, and there was no withdrawal effects. And so that's important to know. But the other part of that too is that like, I say there's no withdrawal effects, and that's true. But if you take CBD and then it makes you feel better and you're less anxious, you're more social, just feel better overall, and then you stop taking it, you'll return to baseline, right? So you won't get the effects of it anymore, but that's not withdrawing from it. That's just, returning to baseline. So sometimes people can get confused with that. You know what I mean? So it is something to kind of consider.
And when it comes to like when I look back at some of my friends in high school that were heavy users, they had you know the they had the munchies. They were seemed to be amotivated. Like they really didn't seem to want to get going with life. Is that the THC component or CBD or what part of the cannabinoids is that part of?
Well, I think mostly like laziness is mostly just from like your own personality and like a choice for the most part, in my opinion. Like cannabis can make you high, but like, and if you find that, getting high makes you lazy, then you can say, cannabis makes you lazy for sure. But, there's other people like, Snoop Dogg and Wiz Khalifa who seem to be working 16 hours a day who are constantly high all the time, who are doing okay. But, that's not everyone. And I don't advise against that. And I just don't like the idea of being, dependent upon anything. And, I'm in from the same boat. Like I can think of people in my high school who, smoked pot when they were, teenagers, and it kind of seemed like it messed them up forever. They never really, got going again. And so, again, like you have to be really careful about using this when you're under 25, especially when you're under, 21 years old. But, in terms of like the laziest component and all that kind of stuff, like if you look at all like every single study, like literally every single study that shows that cannabis users have lower BMIs than non-cannabis users. Like the last time I looked, I think there was 9 different studies and they all showed the same thing. And so, what's the reason for that? Like, I'm not entirely sure. Some people have these interesting theories on it. Like there's one on PubMed where it thinks that if you're using high THC, that this is sort of an odd one. It says that like basically it fixes the omega-3 to omega-6 ratio somehow. And so because of that, people are less inflamed and they're able to, carry on and live healthier lives. But and then some people think that there may be like a slight like healthy user bias to it. Like I don't know if that's true or not, because I know lots of people who smoke pot who are healthy, but I know lots of people who smoke pot who aren't healthy too. So, I don't know if I buy the healthy user bias one or not, but yeah, something that we need to kind of tease out, because if you look at the literature, like it basically says again that like cannabis users always have lower BMIs than non-cannabis users.
Amazing. And and sorry, the quote unquote munchies, forgive me for lack of a better word. Is that a THC thing or is it like a CBD
No,
thing?
that's a THC thing.
Oh,
That's a
that's a T.
THC
Okay.
thing. Yeah, I'm a little bit I haven't reviewed this too much recently, but I think it's the increase in ghrelin that it does that makes your that's a, as a signal to your body to then to start eating more. And so, we know that that exists. I'm not saying that the munchies doesn't exist. It definitely exists. And if you're someone who's, sensitive to that, you got to be careful with it, because obviously overeating has a lot of consequences.
So what I'm hearing though, Mike, is that a lot of the associations that we had at least when I was younger with cannabis, is a lot of it was related to THC. Now that I'm hearing this, it's like the high, the giggles, the munchies, like that. And so like that's a lot different than taking some CBD or derivative of CBD in terms of implication. So this is like I know maybe I'm sounding a bit ignorant to a lot of people, but this is very enlightening to me because you know it's that landscape, especially as like I mean I have some credentials for this, but I found it very challenging to work through because like you hear about these ratios, you hear about these something only has CBD, it doesn't have THC. So like I think that to me, Mike, this is super clarifying. And so just a couple questions about some of the other versions. So when you mentioned the CBG, you said to improve memory, it showed that it could improve memory. Is that something that would people would take during the day? Like because like if I took CBD during the day, or I'll say CBG now, would I be sleepy? Well, you know what I mean? Like wouldn't that affect like my alertness?
Generally, no. So if you use a low dose of THC, I know it's odd that like, okay, some people are taking the same thing during the day and that they're using to sleep at night. And so, if you take a low dose of CBD, it seems to be a little bit activating, but if you take higher doses, then it seems to be a little bit more sedating. And so, and like, what's the um dose for people, that varies so much. And so I usually tell people though to start with about 10 to 20 milligrams and see how that goes. I find that when people use those kinds of doses, they don't get sleepy. But yeah, that would be the only, or I guess sort of the biggest side effect from CBD would potentially be sleepiness. But like I said, it's very low unless you're going like higher doses. You know what I mean? Like it's like 20 milligrams. Like I would compare it maybe to what like no data on this kind of spitballing, but maybe something like Reactin or Claritin. Like those things aren't really supposed to make you tired because they're H1 or H2 antagonists. I forget now which one it is. So they don't make you tired, right? And so for most people, they find that using low doses will not make them tired. And for some people, it almost I don't want to say it gives them energy. Like it doesn't increase ATP or anything like that, but what happens is that if you're super anxious, you're always kind of like, burning your energy sort of thing, and then eventually you can, feel tired. But if you can kind of just like eliminate that anxiousness, then you can just feel more like smooth, and then that just kind of gives you like a more smooth, sustained like energy throughout the day. Whereas if you're like super anxious all the time, like, you're kind of burning your energy. And so, when people say it gives them energy, it's not like it's doing something like super special to the mitochondria to increase ATP or anything like that. It's just that it's helping you calm down, so you're probably not burning off as much.
No, I love it. This is so clarifying, Mike, and I just just really wanted to thank you for clarifying some of this. We're up against it, and just because I know you got a good finger on the pulse, I know this is going to seem like a very random question, but what any like new approaches to health for you these days? Like anything that you're excited about that you've been exploring? Like some people might be sauna, some people might be because I mean, hearing you talking about mitochondria and stuff, like I feel like you'd have a finger on the pulse. But anything that emerging for you in your life currently?
Yeah, a few things coming out actually. So sunlight and light, I've been studying like crazy. So I'm happy to chat about that. And then yeah, like mitochondria health, been studying a lot as well. And like I had Dr. Casey Means on my
You
podcast,
brought
and she
Casey
was
on your show?
yeah, yeah,
Holy
yeah, yeah,
snap,
yeah.
man! If you can make that intro, I'm going on the record. She's a beast,
Yeah,
man.
she's awesome. She's
That's
awesome.
that's a old dog.
We thanks, brother. So we talked a little bit about mitochondrial health, and I've been studying that, but maybe I will just chat about light first, and then we can chat about mitochondrial health if that
Actually, we
sounds good
did
to you.
a recent show on light, so I'm wondering if you could do maybe dive a little bit into mitochondria. Actually,
Sure. So mitochondria, we know that's sort of like it's known as like the powerhouse cell, or the powerhouse of our cells that generate ATP. And so, you want to do anything you can to, make sure that your mitochondria are functioning optimally. And you also want to make sure that you're not doing anything detrimental that disrupt your mitochondrial functioning. And so, if you are someone who's looking to increase energy and you haven't looked into mitochondrial function, like this is something that you could do. So with like behavioral things that you can do, like zone 2 cardio has actually been shown to help with mitochondrial function. And I've also seen, Dr. Rhonda Patrick recently talk about, high intensity cardio can help with mitochondria as well. So, it seems like getting a mix of the two seems to be pretty good. And so, how does that look like for my routine? So, in 7 days, sometimes I'll get an MMA just once, sometimes it's twice. And so for that time, there's not too much, low activity. I'm going pretty hard, during those sessions. But when I'm not doing that, what I do is I just walk on the treadmill. I put it at the incline at 12. I put it on 3.3, and then I go for about 46 or 47 minutes. Ends up being 2.5 miles. I burn 500 calories, and that's the way I incorporate it into my routine. And in general, what I do is like I'll do weights one day and cardio the next day, like more or less. And then the days that I do my MMA, I just count that as like a cardio day essentially. But coming back to other things that can help with mitochondria. So we got cardio. I won't get into it too much because you said you just did a podcast on it, but red light can help. Red light and near infrared light. So photobiomodulation. And so it's usually from about 600 to 1,000 nanometers is sort of like the optical window, so to speak. And so that's why a lot of these, red lights have, they usually have one, like the red light panels, they'll have like one at around like 660 or 650, something like that, which is just the red light, which you can visibly see. And then there's the near infrared light, which you can't see, which also penetrates the mitochondria, which also penetrates deeper. And so once they reach the mitochondria, they both do the exact same thing, but the near infrared light does get in deeper, and it does seem to be able to do more overall. So those are kind of like some things you can do to help, and also to, as we know, sleep. If you don't sleep, everything kind of goes haywire. So there's a few things that you can do to kind of minimize it, minimize alcohol consumption as well. I'm not saying never, on Friday and Saturday, sometimes I have a couple drinks. I don't have any more just because I don't like the way it makes it feel. I don't want to be productive the next day and that kind of thing. But, make sure that you're not doing things that damage a mitochondria before. Look at certain medications as well. Like unfortunately, like statins, have been linked to like some mitochondrial dysfunction, so, you do have to be careful with that. And then there are quite a few supplements that can help with mitochondrial function. So Dr. Casey Means and I went through these, quite extensively on my podcast. So Alcar or acetyl L-carnitine, that can be pretty helpful overall. There's one called urolithin A, which is a new one. There was a meta-analysis on that recently, which was not like overwhelmingly positive, but still showed that it could improve mitochondrial health. What else can improve mitochondrial health?
Can I ask, Mike, like, do people, if you improve your mitochondrial health, do people feel any different, or is it more like a longevity, like efficiency with energy perspective? Like, do you feel different?
Yeah, like some people can feel different literally after taking like mitochondrial optimizers. Like literally like the first, within like an hour of taking it, they can feel like their brain is kind of like turned on. So, it's almost like a daily nootropic to help with your overall energy and vitality. And so, I think that it's something that, can be used over the long term. And, anything that optimizes your mitochondria is going to help with your energy. And like to answer your question, like, yes, like you're going to have like more energy to do things, like to do whatever that you want to do. Like, I do think that is like an untapped resource for some people for just improving overall energy and health. But again, like it's just one thing. Like if you take all these supplements, do all this stuff, but you don't sleep well, you're still not going to feel energetic. If you sleep well and take all these supplements, but your testosterone's in the boots, you're still not going to feel energetic. So, there's so many different things that contribute to energy overall, and mitochondrial health is just one of the ones, but it is one that maybe has been neglected and that a lot of people could probably improve upon.
Yeah, yeah. This is great because this is like almost everything we've talked about today, a bit of a mystery to me, but it's great to hear. This will be version 2, Mike. You'll come back on and maybe we'll get into the light stuff a little bit more too. But awesome having you. Like you just I don't know. I feel like you're all over my IG feed and my X feed. You just seem to be like on top of everything. Where can people get a hold of you?
Well, they can get a hold of me on Twitter, Instagram. It's Dr. Mike Hart on all of it. So it's just DrMikehart. I also have my own podcast called Heart to Heart, where they can find me there. So you just put in my name online. You should be able to find out a little bit about me pretty quickly.
Amazing, Mike. Yeah, and the podcast is glorious. We made a couple appearances on that bad boy. I didn't realize Dr. Means was on it. That's a beast of a find. But keep up the great work, my friend, and you're making us all real proud, fellow Canadian folks.
Thank you, brother.
Talk to you soon.